Hi guys, today we're talking about medical marijuana and its uses in gynecology like chronic pelvic pain or endometriosis, nausea, or how it can affect fertility. Today we're going to talk about medical marijuana. First of all, I'd like to just state that it is a federally illegal drug. Even though it's been approved for medical use in certain states, it is still considered illegal in the whole country. So I don't encourage anyone's use of marijuana for any reason. You can talk to your doctor about what special conditions you can use it under. Today we're just going to focus on the people who are already using. In the US, marijuana products called cannabinoids are approved only for chemo-induced nausea and vomiting and as an appetite stimulant. Yet, a lot of doctors will prescribe it for pain relief, either to use with other pain medication or alone. And a lot of my patients I see a lot of patients for chronic pelvic pain or endometriosis, and a lot of my patients are on marijuana for this purpose. I've had a mixed review. I mean, I have some patients who believe that it does improve their pain, and I've had some patients who use it only with other pain medications, and that's the only way it works. In the medical literature, there's really only a couple of studies that were done, and only one of them showed some evidence that it does improve pain in pain syndromes. Other than that, we really don't have any evidence. It could just be placebo, or it could just be, the use of other pain medications that the patients are also taking. And I've even had patients who use marijuana for nausea. So a lot of times from the severe pain that they have during their periods, they will get nauseous and vomit. So this, by smoking marijuana or by consuming marijuana in some way, their nausea improves. And I've even had patients who consume marijuana for very bad nausea that they have during pregnancy. So I don't encourage this at all. It's a bad idea to consume any drugs when you're pregnant. But this is something else that I've heard from patients. Some patients will smoke it and I encourage them not to, but sometimes it's the only thing that will make their nausea go away. So something that's important to point out is that the studies that have been done have been on taking these medications in the medication form like a pill, as opposed to how most patients just smoke marijuana or they eat the product. So there haven't been any medical studies done to try to see if this way of taking it in causes any improvement in pain at all. So the side effects of marijuana are drowsiness, fatigue, nausea, vomiting. Some people can have hallucinations. Some people can have euphoria or feeling very active, dry mouth, confusion, loss of balance. And then because of this dry mouth, some people tend to have periodontal disease or can easily get periodontal disease because of this dry mouth that it causes. If you're smoking marijuana, there's probably a potential risk of lung cancer since it does contain a lot of carcinogens, that the same as tobacco. But of course, people who are smoking marijuana aren't smoking as much as people who are smoking tobacco. But it can also give you, the same side effects in your throat or in your lungs, like it can cause mucus production, throat irritation, stuff like that. And the way that marijuana affects the reproductive system, in particular for men, it can cause a decreased production of testosterone. So that in itself, it can cause decreased libido, or it can even make the sperm count will be less, and the mobility of the sperm will be decreased, meaning that it won't move towards the egg as it should. And that can decrease the fertility of a man by consuming marijuana. So a lot of my patients that are trying to get pregnant, a lot of times their partners smoke marijuana. So always, if you're trying to get pregnant, none of you can be smoking marijuana because it's going to affect your fertility for sure. Because of the decreased testosterone, it can cause a little bit of a breast on the male. For women, it can increase your hormone called prolactin, and that can give you secretions through your breasts. So definitely, if any of this is happening, you have to go see your doctor. In doing my research for the video, I found that a lot of times there's misconceptions and there's thoughts that there's like 10 different types of orgasms that you can achieve, but really there's only 2 real physiological types of